Thank you for joining us for this training on the crisis system of care. My name is Wendy, and I'm the project coordinator for the Early Diversion Program at Southwest District Health.
And I'm Cass, the project manager for the crisis centers in Idaho's Public Health Region 3, supporting Adams, Washington, Payette, Gem, Canyon, and Owyhee counties. During this presentation, you will learn about the crisis system of care in Southwest Idaho and how to navigate it. So let's get started. We will be discussing the three pillars of the crisis system of care, which are 988, mobile response teams, and crisis centers. 988 and mobile response teams work the same pretty much throughout the state. However, crisis centers are unique in each region. The white dots on this map of Idaho show the locations of the crisis centers. There are 9 adult crisis centers and 4 youth crisis centers across the state. In this presentation, we will discuss 988 and mobile response teams, which again are applicable statewide, as well as the Region 3 Youth and Adult Crisis Centers specific to Southwest Idaho. Let's start with a couple questions to think through. So thinking about your current process for helping individuals during a crisis, whether at work or in your personal life, just think back. What do you do? For example, for a child or teenager in crisis where neither home nor a hospital are the best place to de-escalate, do you know how to help? What about an adult in your life who needs immediate support from a mental health professional? Do you know where to direct them? By the end of this training, it is our hope that you will be able to confidently answer these questions and have the tools you need to support anyone in crisis. We're obviously going to be talking a lot about crisis throughout this presentation, so if this brings up anything for you, we do encourage you to take care of yourself in whatever way that looks for you. Now, crises can and do look different for everyone and often vary by age. A crisis for a young child will probably look different than it does in a teenager, which will probably look different than it does for an adult. In Idaho's crisis system, a crisis is defined and determined by the individual and/or family in crisis. Oftentimes, we think of a crisis as thoughts of suicide or having an active suicide plan, but not all crises are that acute. We encourage people to not only expand their current idea of what a crisis looks like, but also to understand that the crisis system can be accessed for any level of crisis from 1 to 10, including crises related to challenges, navigating mental health conditions, abuse or neglect, grief, social issues, substance use, and even behavioral health concerns that stem from loss of access to basic living needs. The crisis system has 3 main purposes. Now, the first is to divert people from unnecessary involvement in the justice system, admissions to emergency departments, hospital stays, and even potentially unnecessary inpatient stays for behavioral health reasons. Crisis services are specifically designed to support behavioral health crisis. They're low barrier resources intended to get people to not only the right place, but at the right time for their needs. Getting support from crisis system providers can also help to prevent future crises such as substance abuse, self-harm, harm to others, suicide, or overdose. The final purpose of the crisis system of care is to return individuals safely back into their homes and community after de-escalation. While the crisis system of care isn't necessarily in the outcomes business, because unfortunately we don't always get the opportunity to follow clients throughout their healing journey, these services can and do help instill resilience and self-sufficiency skills to promote well-being. All services in the crisis system of care in Idaho are free and available to everyone everywhere. While portions of this presentation are specific to Southwest Idaho, anyone in the state can access free crisis support 24/7, 365. Insurance isn't required and there's no limit on usage. So like the 911 system, which for example gives us access to emergency medical services, we are in the business of providing care, whether help is needed once or even dozens of times. Now, before diving in to talk about the specific services in the crisis system of care, let's talk about how the system is managed. So, previous to 2024, the crisis system was segmented and managed by different organizations. The system is now managed under one organization, Magellan, which is Idaho's behavioral health managed care organization funded by the Idaho Department of Health and Welfare. Now, while the crisis system of providers still do vary by pillar and location, the overall system is now under one umbrella for better coordination of services across the state and between the different types of services we provide. The system is modeled after national best practices for crisis services, and the goal is to continue to improve the system to best meet the needs of Idahoans. Now that we have a foundational knowledge of the crisis system and understand its background and purpose, let's dive into the services. The crisis system has three pillars of care: someone to talk to, someone to respond, and somewhere to be. I'm going to pass it over to Wendy now to talk about the first pillar of care, 988.
Thank you, Cass. So the first pillar in the crisis system of care is someone to talk to. That number nationwide is 988. We've all been trained to call 911 during emergency. Now there is a new 3-digit number, 988, that you or a loved one can call when experiencing a mental or behavioral health crisis. Like 911, it's free and can be reached 24 hours a day. The challenge can be deciding when to call 911 and when to call 988. 911 should always be called when there is a medical emergency, such as a heart attack, or if there's a fire or a crime's in progress. 988 should be called when someone is in crisis due to a mental or a behavioral health issue, substance use disorder, suicidal ideation, or other situations that could benefit from de-escalation assistance. When you call or text 988, the crisis phone responder can determine if or when law enforcement or first responders need to be involved. You can be confident in knowing that 988 crisis responders will make sure that the correct people will be involved in any crisis situation. 988 is a national number that in Idaho is operated by the Idaho Crisis and Suicide Hotline. The 3-digit 988 number went live in 2022 as a universal mental health and suicide prevention number, replacing what was a 10-digit number. This is a free service available 24/7 for anyone experiencing a crisis or someone that has a friend or a loved one experiencing a crisis. The phone responders are highly trained and prepared to provide crisis de-escalation, safety planning, resources, or help getting higher levels of care if that's what's needed. It's helpful to understand what happens when someone calls 988. The call begins with a brief pre-recorded message that offers several options. If the caller selects one of those options, they'll be routed to the national support line outside of Idaho. By staying on the line without making a selection, the caller will be connected to the Idaho Crisis and Suicide Hotline. There may be a short wait with music while the call is connected to a crisis responder. When the responder answers, they'll introduce themselves and they'll begin by checking on the caller's safety. Once safety is established, the phone responder will invite the caller to share what's happening. The responder will listen, they will ask supportive questions, and work collaboratively with the caller to provide support and develop a safety plan. A safety plan is created together by the individual in crisis and the crisis responder. It outlines coping strategies, sources of support, and practical steps to help reduce risk and promote safety when someone is experiencing suicidal thoughts or other potentially dangerous situations. If you are participating in this training and have never called 988, but expect to encourage others to seek help, it's recommended that you call 988 yourself. You can let the responder know that you're not in crisis and you're calling to learn more so that you can better support your family or your community members. Having this firsthand experience can help you speak more confidently and authentically when encouraging others to reach out for help. 988 is available in multiple languages, including English, Spanish, and American Sign Language. Individuals can also text 988 or use the online chat at chat.988lifeline.org. Youth can call, text, or chat with 988 anytime without requiring parental or guardian consent. One final point about 988 before we move on. Most crises can be successfully resolved through 988 alone. 86% of calls and texts can be de-escalated over the phone. For situations that cannot be resolved over the phone, 13% receive additional support through mobile response teams or crisis centers. Only 1% of 988 contacts involve law enforcement or emergency medical services. So now we're going to move on to the second pillar of the crisis system of care, someone to respond. In Idaho, this pillar is the mobile response team. During a call 988, the crisis responder might determine that the most effective way to support the individual in crisis is to dispatch a mobile response team. Mobile response teams can meet individuals at their home or school or any public location and provide free in-person support. These teams can be dispatched at any time, day or night. The two organizations that provide these mobile response services across Idaho are Community Bridges and Benchmark. Mobile response teams typically arrive in a white vehicle, often a Subaru or an SUV. Each team is staffed by 2 behavioral health professionals who, if necessary, can work with first responders if that's what's appropriate. It's important to remember that participation with mobile response teams is voluntary, and the individual must be willing to engage with a mobile response team. Guardian consent is required for youth to access mobile response teams outside of an emergency situation. The average response times can vary by location, but in Region 3, the average response time is 43 minutes from dispatch to arrival on site. It can be longer if you are in a remote or rural area. Mobile response spends on average 98 minutes with the person in crisis to help de-escalate and create a safety plan. During their visit, the mobile response teams may decide that a higher level of care is needed to help the person stabilize. They will discuss options with the person they're supporting and decide together where the most appropriate next level of care might be. When they've come to that agreement, the mobile response team can then transfer the person to the location, such as a crisis center, a hospital, or an emergency department for ongoing support. Mobile response teams are not medical transport and they're not secure transport. In situations where medical or secure transport is needed, mobile response teams may work with first responders. It's important to remember that both 988 and mobile response teams are available to anyone, anywhere in Idaho. They're free. They do not require any health insurance to access. So now I'm going to pass it over to Cass to provide you with information about the crisis centers and the vital role they play in crisis support and stabilization.
Thanks, Wendy. So in Region 3 of Southwest Idaho, there are 2 crisis centers. These are the third pillar of the crisis system, a place to be. The first is the Western Idaho Community Crisis Center in Caldwell, which opened in spring 2019. The second is the Western Idaho Youth Support Center, which opened in January 2024. Both centers are open 24/7, 365. If you're not sure how to find us or reach us, pause on this slide before moving on. First, let's talk about who's eligible to receive services at the crisis centers. So to receive services specifically at the Western Idaho Community Crisis Center, you must be 18 and older, while the Western Idaho Youth Support Center serves youth ages 5 to 17. Legal guardian consent is required in most cases before we can admit youth for services. In cases where legal guardian consent is difficult to obtain or can't be obtained, the center does work with law enforcement and or the Department of Health and Welfare to identify how to best support the youth. Runaway youth or youth seeking emergency shelter may receive services without guardian consent if the center attempts to contact a guardian and local law enforcement is informed of the youth's location. It's important to remember that crisis services, including crisis centers, are voluntary. Clients need to want to be there and need to abide by the code of conduct, which means they cannot be violent or threatening to staff or other clients or anyone else in the center. Crisis centers in particular must be a safe space for everyone. A different level of care might be required if highly elevated individuals cannot be de-escalated through verbal means. Since the crisis centers in Southwest Idaho do not do mental health holds, and we do not use any sort of physical restraints. Additionally, clients must be medically stable. If they are not, the individual will get support transitioning to one of our health system partners to be medically cleared, and then can come back to the center afterward if appropriate. And while the centers are ADA compliant and accessible, clients must be ambulatory by being able to conduct their own activities of daily living, such as getting in and out of bed on their own, being able to use the restroom or showers on their own, eating, etc. Clients must also be coherent enough to get through intake and understand the services that they are agreeing to. Since we only staff EMTs who can manage basic medical needs, and because we don't prescribe medication, medical stability, including not needing medication to get through detox, is required. Even though there are some eligibility requirements, we do not require an appointment. We don't require referrals, insurance, or even IDs to receive services. Anyone can walk in anytime, day or night, and they don't have to call 988 first. We know that crises can't be scheduled during normal business hours, Monday, Friday, 8 to 5. That's why we're always open and we're always free. And while we serve counties in Region 3, again, that's Adams, Washington, Payette, Gem, Canyon, and Owyhee counties, we will not turn away people from any other area, even if they come from out of state. Now let's talk about what services people can receive at the crisis centers in Southwest Idaho. Our support staff include EMTs, behavioral health clinicians, case managers, and peer support specialists who are trained in crisis prevention and intervention so that no matter who a person interacts with, they're in good hands with people who care about their needs and know how to support them. Our free services include behavioral health and medical assessments, crisis de-escalation, non-medical detox, connections to care and resource navigation, and safety planning. We also provide clients with food and things to drink, beds to rest and sleep, new donated clothing, laundry, showers, personal care items, anything like that if needed. The Adult Crisis Center has 20 beds, and the Youth Crisis Center has 9 beds with separation between gender. And in the case of the Youth Crisis Center, we do also separate by age, ability level, and any other factors to ensure that clients feel safe and comfortable. We encourage people to never worry about taking up a bed that could be used for someone that might need it more. The crisis centers are never full and everyone is welcome. Individuals can stay at the centers for up to 23 hours and 59 minutes in a single episode of care, with reevaluation available for those who need to be readmitted. For example, they might still need support working through their crisis, or maybe they're waiting for a bed to open up at a residential facility. The Western Idaho Community Crisis Center may be able to offer transportation to and from the center on a case-by-case basis if the individual doesn't have transportation access. If someone needs help getting to the center, they can call us at 208-402-1044, or they can call 988 to get support from a mobile response team, who can then get them to a crisis center if they still need it after mobile response team intervention. The Youth Crisis Center does not provide transportation, so we do encourage individuals and families with transportation needs to utilize mobile response team support and request a ride to the Youth Crisis Center after intervention if needed.
Thanks, Cass. Well, we hope that this training has been informative and that you now have a better understanding of how to help during a behavioral health crisis. The 3 pillars of the crisis system of care, from calling or texting 988 to mobile response teams and the crisis centers, are here to support anyone, anywhere in Idaho experiencing a crisis due to mental or behavioral health issues, substance use disorder, suicidal ideation, or other situations that could benefit from de-escalation assistance. It's important to understand that there is no wrong door to enter the crisis system of care. You can enter through 988 or walk directly into the crisis center. Accessing these services can help prevent future crises, substance use, self-harm, harm to others, suicide, and overdose. They also divert people from unnecessary involvement with justice systems and admissions to emergency rooms or inpatient hospital stays. The most important takeaway from this presentation is an understanding that the crisis system of care is here to make sure that our families, our friends, and communities have the support they need during a crisis. So thank you for your time. And if you have any follow-up questions or would like an in-person training or informational materials like brochures or flyers, or you would like a tour of the crisis centers, please reach out to us at the emails listed on this slide. We would also love to hear from you. If you take a minute, please use the QR code and tell us how we did. Thank you.